Hi, welcome to Case of the Day, and today is Tuesday, and so we are on the second case of the week, or the 53rd case since I started this. And the topic today is the symmetric facial edema pattern of dermatomyositis. So, this is a 35-year-old man diagnosed to have DM with limb pain on treatment, came for a baseline myositis protocol MR. And I did this, I think, almost 2 months ago, and talked about this case of dermatomyositis and the myositis protocol MR. This patient, of course, has severe atrophy without edema. And this is the protocol. You do the two upper limbs, pelvis and thighs and legs, 3 sequences per area to understand what's happening to the muscles. Now, our patient has this classic pattern of facial edema, and it goes into the intermuscular facial planes in the most marked in the posterior compartments of the legs. So you're involving, the semimembranosus, semitendinosus, the sartorius, gracilis, and there's also this edema along the anterior compartments, the vasti. You of course have to be very careful that you're not dealing with any artifacts, but clearly that isn't the case here. And higher up, more superiorly, you see again this pattern of facial enhancement. In the legs as well, there's symmetric. At each level, it's symmetric, but it's patchy. I mean, it's not as if every facial plane is involved, but there's symmetric involvement. And in the upper limb, similarly, that's the left, that's the right. You see edema along the anterior and posterior facial planes, both in the upper and the lower arm. Uh, Probably the first time this was written up was in 2010, when a Japanese group discussed this. And you can see this image A that talks about or that shows the facial edema so well. And they said that this is a typical pattern of dermatomyositis. You don't see it in other conditions. And then there's been this paper, and this is a wonderful paper that you should read, and I think it's free to access if you're in India. From the perspective of MR and myositis, and they have this picture. So they've now divided MR patterns into 6: facial, peripheral, honeycomb, foggy, dense dot, and coarse dot. And each of these typically point towards a specific myositis, and also point towards or kind of give a direction to the prognosis and what further may need to be done. But of all these 6 patterns, the facial pattern is the most striking, easy to pick up, and of course is characteristic of dermatomyositis. And there was another paper that said that it occurs specifically in one type of dermatomyositis, and I'll come to that. So this was another patient we had, and I'd shown this in that case 21, where we have reasonably symmetric facial edema without any significant muscle edema. So this symmetric facial pattern of edema, even without muscle edema, is a manifestation of DM. And this is the antibody, anti-transcriptional intermediate factor 1 gamma anti-T1F TIF1 gamma antibody related myositis or DM. But all of this is rapidly evolving stuff that is difficult to keep track of. But the bottom line is, if you see this on MR, remember that this is DM. Or if you have a patient with DM, then you just have to document this finding. And as that 2024 paper shows, the various patterns of muscle involvement are being better and better characterized with biopsy correlation. And hopefully, as time passes by, we will know more about each pattern and what it means and stuff like that. So it's just good to remember these patterns. If you ever do an MR myositis scan, actually keep that in front of you, see what pattern it fits into, and describe it accordingly. That's the leadership summit on Saturday. If you're in Mumbai or in and around, you should attend this. And that's the WhatsApp channel, and thank you so much for viewing this.